Hello friends, today we're going to discuss about examination phobia. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. This is not a substitute for professional clinical opinion. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I am going to discuss about examination phobia. How is it different from exam anxiety, the definition of examination phobia, and how to manage examination phobia. The first and the foremost, we should know what is phobia. Phobia means an excessive, irrational, unreasonable fear to a particular stimuli or a situation. And there should be avoidance of that stimuli or the situation. Along with this, there should be a distress with regard to biological functioning such as sleep, food habit, bowel and bladder habits, occupational dysfunctioning, is unable to go to work, unable to study, and social functioning. So if these are there, then we call it as phobia. One best example I can give you is social phobia, also called as social anxiety disorder. If a person is excessively worried or anxious in a social situation, he feels he will make a mistake or he will lose control and people will criticize him. Hence, he starts avoiding the social gathering. And it is associated with occupational dysfunction. He is unable to go to work and is constantly thinking about the criticism, the people commented about him, and this is called as social phobia. Similarly, we need to know about examination phobia. The various researchers have defined examination phobia. The best definition is the fear of any kind of social situation, especially when a student is exposed to evaluation by others. This is one of the best definition. But however, World Health Organization, in its International Classification of Disease, 10th edition, they have coded in F40.2. It is coded under specific phobia, that is specific isolated phobia. And the definition goes like this. Examination phobia is an irrational fear that leads to the avoidance of exam or test, which in turn increases the severity of the phobia. That means if a person do not attend the exam because he has excessive fear, and again, this will accentuate his fear and he doesn't attend the next exam also. So that is examination phobia. Here the avoidance is classical. But however, one need to differentiate between exam phobia and exam anxiety. Actually, it is a spectrum. It is not a categorical. But however, to the purpose of clinical intervention, we need to define exam phobia and also exam anxiety. As the anxiety increases, the performance starts decreasing. In the initial period of the anxiety, the performance will be at the peak. But as the anxiety worsens, the performance also starts coming down. So, if you look at the extreme end, where the anxiety is very severe, it is called as exam phobia. And exam anxiety is to the other end. And in between, there is excessive anxiety, but without avoidance. Here, the student has excessive anxiety. There is some amount of decline in performance, but he attends the exam. Because to diagnose exam phobia, avoidance to appearing exam or the test is a must. So understanding this differentiation between exam phobia and exam anxiety, one need to understand. As I mentioned, a little nervous or tension, anxiety is healthy for students, that it can help to take proper precaution, to start studying, improves performance. But when the same tension or stress becomes more or excessive, it will hamper their performance. But however, to define exam phobia, avoidance is must. With groundless fear, with avoidance to the exam is must, then only we will call it as examination phobia. Again, to differentiate between exam phobia and exam anxiety, In exam phobia, the anxiety is very severe. Whereas in exam anxiety, anxiety is there but manageable. In exam phobia, it is a groundless fear, illogical fear. Whereas in exam anxiety, since there is an exam, the child or the student is anxious. In exam phobia, avoidance is must. In exam anxiety, they have anxiety, but they do go to the exams or test. Here, in exam phobia, the performance is completely hampered because he's not attending the exam. He is running away from the exam. Whereas in exam anxiety, the person attends the exam. Though he is anxious, the performance may be good, he may score above average, and he may be showing distinction. In some cases, though he has attended the exam, but the anxiety is coming in the way of performance, there may be decline in performance. In exam phobia, the biological functions are hampered. The sleep is hampered, appetite is hampered, he is unable to go to school, he avoids schools, he doesn't study, he finds it difficult to engage in study. Whereas in exam anxiety, there will be mild impairment in biological function. And one need to understand, exam phobia is associated with some or the other mental health comorbidities, such as selective learning deficits or selective learning disability, intellectual disability, depression, panic disorder, even social phobia, obsessive compulsive disorder, emotional disorders, and it may be post-traumatic stress disorder, extreme anxiety. So various comorbidity will be seen. Whereas in exam anxiety, there will be no comorbidities seen. But however, one need to understand, exam phobia can be observed in unprepared students, fully prepared students, normal students, and over-prepared students. That means exam phobia is an illness. It is illogical, groundless fear. That means it can be seen in any kind of students. But exam anxiety is commonly seen in unprepared students, and fully prepared may have some amount of anxiety, but they will be able to manage it. Let's understand, do we require exam stress? If you look at the x-axis, that is the intensity of stress, and in y-axis, the performance. Whether we like it or not, in life there will be stress. And stress depends upon how do you perceive an event. As the anxiety or the stress increases, the performance increases. But at one place, the person starts performance declining. That means it is called as distress. Here, the decline will be very, very sharp. Hence, we need to keep the student in new stress situation. And every student has different coping capacity. That means the resources to cope with the stress, including exam. The stress can be anything. Stress is inevitable part of life. Hence, we need to teach our students how to deal with stress, because the stress is inevitable part of life and they should know how to become resilient, not only in the exam, in difficult situation of life. Let's understand the symptoms of examination phobia. It can be divided into 5 different domains: somatic domain, emotional, behavioral, cognitive, and biological domain. In somatic domain, a person who is suffering from examination phobia will have headache, backache, body ache, chest pain, fatigue, joint pain, gastritis, and various somatic symptoms will be there. Moving to the emotional symptoms, the person will have anxiety attacks, panic attacks, low mood, crying spells, irritable, numbness, anger, frustration. They are common. Behavioral symptoms: hostility, isolation, avoidance, withdrawal, crying, substance use, alcohol use, drug abuse, sometimes internet addiction. To overcome this anxiety, they indulge in pornography or playing games. The fourth domain is cognitive symptoms: confusion, decreased attention and concentration, disorientation, poor memory, poor judgment. So these can be seen as a cognitive symptoms. Whereas with regard to biological functions, insomnia, difficulty to fall asleep, decreased appetite, decreased libido, altered bowel habits, bladder habits will be changed, frequent micturition. So, these are the commonest symptoms we see in examination phobia. But to clinch a diagnosis, avoidance for the exams or the test is a must to diagnose examination phobia. The common symptoms which we come across are anxiety to specific stimuli, that is, exam or test, altered behavior like irritability, anger outburst, crying spells, not able to sleep, palpitation, breathlessness, restlessness, fidgetiness, sweating, frequent micturition, going to toilet frequently, avoidance of the exam, and cognitively they will be thinking fear of failure, criticism, evaluation, that somebody will evaluate or scrutiny me. So these are the symptoms commonly seen in children who's facing examination phobia. What are the causes for examination phobia? It can be divided into four: parental, students, schools and teachers, and community. So if you look at the parental pressure may cause examination phobia. Imposing expectation by the parents on the child, comparing the child with others, criticizing the child, pushing the child for all or none thinking. If you don't get 95%, it is equivalent that you are going to die. That means you are good for nothing. Your life will be wasted. That means extreme form of thinking. Either you should get a first rank or else quit studies. That is the way the parents will put across. If you don't get 98%, you are good for nothing. Better you go and do some silly jobs. These kinds of parental pressure will induce extreme anxiety, especially exam anxiety, and sometimes they may be pushed for exam phobia. Coming to the students, they also have certain high risk factor. They themselves may have high expectation. I should get 98% or 100%. But at the same time, the preparation is poor, procrastination, delaying ready studying, or preparing for the exam. And if the student has comorbid conditions like drug abuse, alcohol use, depression, other social anxiety disorder, obsessive compulsive disorder, SLD, conduct disorder, in such a scenario, the child or the student will develop exam phobia. With regard to school teachers and the school, punishment for those children who do not score more than 90%, insulting these students and parents in front of others, telling that the student is good for nothing, and insulting the parents, telling that you are not taking care of the child. So the child indirectly gets anxiety because of me, my parents have been insulted. Criticizing and degrading students in front of others. Punishment by other students. That means if the child did not score well, the first rank holder may come and become the monitor and punish this child who has failed. At the same time, preferential treatment for the child who has scored very well and the child who has failed will be degraded, criticized, and punished. At the community level, perception of an exam failure is also very essential. Comparing children with others who have scored well will bring in the extreme anxiety. Sometimes the child who fails in the exam may attempt suicide, or else death by suicide is common. Let's understand what are the comorbidities we see with examination phobia. That means what are the other illnesses we see with examination phobia. First and the foremost is intellectual disability. Here, if the child has less intelligence and you are pushing the child to get 98%, where will the child go? If the child has specific learning disorder, especially mathematics, maybe language, do not know about the grammar, finding it difficult to understand about the English, maybe physics, maybe science. In such a scenario, imagine if the child is punished. So the child has specific learning disorder, but the parents are punishing the child, school is punishing them, and friends look this child as a failure. The child may have depression, psychosomatic disorder, where the child will be having repeated abdominal pain, headache, asthma attacks. So psychosomatic disorders are common. Other anxiety disorder such as social phobia, panic disorder, drug abuse, substance use, and nowadays non-substance dependence, that is internet addiction, pornography addiction, gaming, spending time on social phobia. If the child is going through a marital discord, imagine the parents are fighting day in and day out. The child feels that he or she is responsible for their parents' fight. Domestic violence in the family, child has been abused, child sexual abuse, trauma, and of course, punishment of the child in front of others. Just for a moment, think about yourself. Imagine if you are punished in front of your colleagues. If you are not working, if you are a housewife, imagine in a social gathering, somebody criticizes you in front of others. How do you feel? Similarly, if a child is punished in front of the whole school, or maybe in his class in front of peers, the child is degraded. The child will definitely have emotional problems, depression, or maybe even exam phobia. Hence, these kinds of punishment needs to be stopped earlier, at the earliest if you ask me. What are the cognitive process of these children? Fear of failure, fear of losing control, fear of evaluation by others, criticism by teachers and peers, fear of insulting, fear of embarrassed, fear of letting down the family members because the family feels that he is the flag bearer. He is going to remove them from the poverty. He is going to become the engineer, doctor, IS officer. And if the child is unable to perform, the whole family, so-called the flag bearer, has lost the battle. Fear of not getting the selected college seat, and of course rejection from the family and society. So these kind of cognitive process bears a huge burden on children. Let's move into the neurobiology of examination phobia. What happens in the brain? Here, the dysfunction in fear processing can lead to psychiatric disorder in which fear outweighs the danger or possibility of harm. That means, imagine the child has examination phobia. The fear of failing will lead to the child not going to the exam at all. That means, if there is a chance if he goes to the exam, there is a possibility he may answer and pass, but he has taken an extreme step of not attending the exam. Hence, the fear of failure is more than, hence he doesn't attend the exam at all. So that is the dysfunction of fear processing. One more best example I can give you is social phobia. A child who has a social phobia, if he feels if I go in front of the audience or in front of the students or the public, they may criticize or they may make fun of me or I may lose control. Hence he avoids going in front of the social situation. Although nobody has criticized at this point of time, or the criticism would have occurred long back. That means the risk assessment is completely wrong. That's what it means. At the same time, various neuroimaging studies in primates, especially monkeys, it has been found that bilateral central amygdala and the nucleus of stria terminalis gets activated in phobic patients. And in monkey, if we are able to remove both the amygdala, that monkey loses fear. It doesn't have any anxiety at all. That has been very well documented. Further, dysregulation in the synaptic plasticity, especially in amygdala, causes phobia. Even in functional imaging studies, it has been shown the amygdala is hyperactive. And we will understand now the physiology of the exam phobia. That is, exam is a stressful situation. Invariably, it is the stress response. Examination being a stressful situation, we need to understand the stress now so that the child, the teacher, the parents, and the people involved in education of the child need to understand how the stress behaves and also how the child copes with that. Here, the physiology of stress means this physiology is a branch of biology that deals with the normal functioning of a living organism and their parts. Here, the stress affects every part of the body. Name the part of the body, the stress affects it. That is, from head to toe, it affects. Let's understand, as the stress increases, the performance increases. But at the extreme level of stress, the performance comes down. At the initial period of the low stress, the child is not motivated to study. There will be procrastination. As the exam nears, the child gets motivated, the anxiety increases, the performance increases. As the stress becomes moderate, the peak performance is reached. But if the anxiety increases further or stress increases further, the fatigue sets in, exhaustion, anxiety, anger, burnout is common. Hence, we need to push the child to the maximum level of tolerance, not to the level of burnout. We need to understand every child has a different level of coping capacity. And if you are the parent, you need to know at what stress level the child is able to perform well. Hence, during exams, there should be the combination of stress induction at the same time stress management. Hence, the child should not continuously should avoid studying. There should be stress de-stressing activities, maybe listening to music, going for exercise. Hence, for every 2 to 3 hours, if the child is studying, there should be break. The child should go and de-stress itself. Then the peak performance can be kept for longer duration. That is one need to understand that. So let's understand how the stress. The stress, if you look at that, it is the perception of an event. Parental fight, death in the family, exam will cause the pituitary and hypothalamus activation, which leads to ACTH hormone release, and adrenal gland releases stress hormones like cortisol, epinephrine, and this is a stress response. That means as the exam comes near, the child will have increased anxiety, increased heartbeat, irritability, numbness, and because of the cortisol level, the child will be very susceptible for infection during the exams. That one need to understand. And as the stress level becomes extreme, the child starts decompensating. The child starts crying. The child may not be able to focus on study, and invariably it starts crying very bad, and it will refuse to go to school. It may start fighting with the parents also. So we need to keep the stress at the optimum level. So the stress response are 3F, and that 3F is fight, flight, and fright. We need to keep the child in fighting mode, not in the flight or fright mode. That means the child should not run away, or else the child should not get frozen when there is exam. Hence, we need to deal at the fight level. The child should be kept at the optimal level, and you need to know what is the optimal level for each child. And because of this fight, there will be increased heart rate, increased blood pressure, increased respiratory rate, glucose level will be, that is extreme consumption of glucose will be there, tense muscle, insomnia will be there, mood fluctuation, and altered immunity will be seen. Now, entering that we have understood about examination phobia, let's understand the management of exam phobia. It can be dealt at the 4 level. One at the parental level, second at the school level, at the student level, and the societal level. Actually, it is the combination of all 4 is very essential. One need to understand, exam phobia management is prospective and long term. Unfortunately, the parents will bring the child only 1 or 2 weeks prior to the exam, sometimes 1 or 2 days prior to the exam. During that time, none of the doctors or psychiatrists will not be able to help the child or the parents, because any medication will not be able to help immediately. You may give medicines to decrease anxiety, but the phobia doesn't go. To deal the exam phobia, you need to start treatment at the earliest. As soon as you diagnose the child is becoming extremely anxious, one need to start intervening. This is how the prospective management has to be done. If there is an exam, and if the child does not perform well, or else because of the extreme anxiety the child does not go to the exam, identify first, immediately after exam, identify that, and look at the low scoring if it is there. And if the child is absent from the attending school, now you need to start intervening. Explore what are the different possibilities the child has not performing well. And then you need to start the intervention before the exams. That means maybe around 3 to 4 months prior to the exam. You need to assess the child, involve the family members in this. And community level, you need to discuss about the perception of an exam. Just a child has failed in the exam doesn't mean the child has failed in life. That means it is a prospective. That means the treatment should be long term. But unfortunately, exam phobia is manifested only during exams or test. And in between the exams, the child is completely all right. There is no abnormality at all, but only during the exams, during the test, during the practical, during the interview, or if the child has to perform in front of everyone, then the child becomes decompensated. So you need to deal immediately after the exam. The first step is early identification and treatment. And what is the best way? If the child is avoiding exams, avoiding tests, or else the child has decompensated during the exam, or else the child has prepared well but is not able to perform up to the optimum level, that's the time you need to intervene. At the level of parents, parental education about the phobia and exam anxiety should be discussed. Role of exams is very essential because exams are part and parcel of life. Today, this is an exam. Tomorrow, there may be interview for a job. And after tomorrow, the child need to focus or face the exam stress or else the stress of life. And the parents need to avoid comparing the child with others. Parents also should avoid insulting their kids in front of others. For example, I remember a father telling, "My child is useless and is good for nothing" in front of the relatives and friends. The child was devastated. Please accept your child, even if the child is intellectually disabled, because it is a child. There is nothing wrong in the child. The God has, or the nature has made the child with the less intelligence. What is the problem? Why should we blame the child? And don't push the child for do or die. Putting the child for extreme position. Either you get first rank or else get lost from my house. Don't do that. Imagine if the same position is put to the parents. As a father, if you don't earn 10 lakhs, you're good for nothing. Quit the job. Better you commit suicide. If that is the position placed in front of the parents, think about the parents. What will happen to them? Similarly, you are pushing the child either to perform to 99% or else you're good for nothing. Your life is spoiled. That extreme position should be avoided. At the same time, do not overemphasize on the exam. Focus on the life. Focus on how to develop life skills in the child. At the same time, you need to put the child for regular tests, mock exams. And we need to develop a system in our schools, 360 degree of assessment. Not the assessment of just only the exams, not only the multiple choice questions. It should be 360 degree. That means the child should be assessed from the day one to the last day. Every day should be an assessment. That means cumulative assessment should be taken to the final exam. And we need to stop degrading the students based on academics performance. And all students who have attempted the exam should be appreciated. Prepare the students for failure. Teach the children, if they fail in exam, how to cope. At the same time, if they fail in certain problems or in life, how to cope. This will bring down the students committing suicide. That is, death by suicide can be prevented. Not only that, when they become adult, if they know how to cope with the stress, cope with their life problems, they'll be able to face the problems. Alternative plans, how to overcome the problems, help-seeking behavior, dealing with their emotional problems need to be taught. And emotional turmoil and also managing emotions through meditation, yoga, spirituality need to be adopted. And in the schools, immediately after the exam, explore the reason for the child not attending the exam. Be sympathetic towards the child and the parents. Ask open-ended questions. Involve family members. Explore about any suicidal plans. If the child has, voluntarily ask the students about the health problems, family problems, exam fear, financial issues that needs to be taken care of. If the teacher is good and is able to be very supportive, the child will flourish. That means the teacher can become a role model. In exam phobia or in exam anxiety, the teacher play a very crucial role. Of course, the parents are there, but unfortunately many a time our parents are overdriven with the outcome. We need to educate the parents at any cost. Not only that, we need to tell the parents not to compare their children with others. And if there is extreme anxiety with regard to exam, evaluation of phobia need to be done. At the same time, we need to understand the perception of failure from the student's perspective, educating the child about the role of exams. Exams are not end of life, needs to be emphasized. If required, the child should be referred to cognitive behavioral therapy, in vitro exposure for exams, mock exams, tests should be done. Stress inoculation, exposure and response prevention for the exams to be done, meditation, spirituality, relaxation technique, evaluating the child's intellectual capacity, looking for any SLDs there. If the child has any depression, substance use need to be explored. And we need to change the perception of exam and exam failure. I need to focus on study skills, making timetable, writing notes, revision of these notes. If possible, the child should do group studies, because many a time the child has thinking that he's the only failure or I am the only person who is having extreme anxiety. Doing group studies, the child will be able to normalize its anxiety. At the same time, using digital technology for preparing the exams is highly helpful. And during the exams, good sleep. And if the child is having difficulty in sleeping, repeated panic attacks, evaluation by psychiatrist is must. And if the exam phobia is extreme, the last resort is to consider for medication. Before starting the medication, one need to check for comorbidity, like selective learning deficits, obsessive compulsive disorder, generalized anxiety disorder, depression, social phobia, substance use disorder, disability and psychosis need to be explored. And in early part of many psychosis, there will be academic decline will be seen. That means the child may be in the prodrome of developing psychosis. That's an early indication. Hence, the evaluation by psychiatrist is essential. Focus on the process, not on the outcome. That means, if everyone is born, the outcome is death. If I am born, that means the outcome is death. It is not the outcome. It is the process of living the life. That is very essential. And the perception of an exam and the assessments need to be changed. That means we need to consider exam is part and parcel of the life. It is not the end of life. And we need to enhance the life skills rather than the exam skills. Nowadays, we find students and children extremely good in multiple choice question. Their skills are very poor. You name the profession. It may be engineering, it may be medical, it may be any other profession where they are having 98% or 100% marks, but they are very poor in the market. They are not ready for the market. A MBBS graduate who has come out of his MBBS, he does not know how to speak to the patient. He does not know how to put IV line. He does not know how to prescribe medication or diagnose without the laboratory mechanism. That means there is something wrong in our yardstick so-called exam. That needs to change. We need to focus on life skills. We need to focus on skills. Knowledge is available at your fingertip. That means the Google is there. Nobody wants to know about the knowledge what the child knows. We need to teach the skills, competencies. That's where our education should move forward. And if the exam phobia, the management will be cognitive behavioral therapy, exposure therapy, anxiety management, relaxation technique, and in extreme condition, medications like beta blocker, selective serotonin reuptake inhibitor, benzodiazepine, and various other medications can be considered. And however, World Psychiatric Association has given PQRST technique preview, that means skim the material before the exam. And you need to ask certain questions after reading a chapter. Read actively and also make notes. Note the key important point. Summarize what have you read. And finally, mock test by writing, reciting, reviewing the chapter is very essential. So, this PQRST model is very essential for examination phobia. To conclude, my dear friend, most of the time people become anxious because they think exam is life. Sorry, exam is not life. Failure in exam is not the end of the world. Actually, it is the start of new life with many more possibilities. Thank you very much for giving your valuable time. Examination phobia, exam anxiety is very common. Please address before it is too late. Thank you very much.